Okay, I think we're gonna get started. Good morning, everyone. I'm Assemblymember Karines Reyes from the Southeast Bronx. I am proud to be here with all of you. I'm also the co-chair of the Bipartisan Pro-Choice Legislative Caucus, along with Senator Liz Krueger. The mission of the New York State Bipartisan Pro-Choice Legislative Caucus is to protect reproductive rights across the state and provide a voice for pro-choice state legislators and policy debates at both the state and national level. We have currently 117 members of the caucus. I think we are bipartisan in name only, but in the past we used to have colleagues from the other side of the aisle. Our members have sponsored critical legislation over the years, including the Reproductive Health Act, Comprehensive Contraceptive Coverage Act, the BOSS Bill, the Reproductive Freedom and Equity Grant Program, the ERA, and New York's SHIELD laws. The work of the BPCLC is supported by leading advocacy groups that have helped to get these important bills enacted into law. And today we are joined by the New York Civil Liberties Union, Planned Parenthood Empire State Acts, National Institute for Reproductive Health, Girls for Gender Equity, New York Birth Control Action Fund, and the Empire Justice Center. And I'm going to pass the mic on to my colleague, Senator Liz Krueger.
Good morning, everybody, and thank you so much for always being there in partnership, Karines Reyes, because it's a big set of assignments for all of us at this moment in history. And let's face it, if we don't keep doing what we've been doing in New York to protect reproductive rights and access to reproductive, sexual, and trans health care, given the bombardment of attacks from federal government and anti-abortion states, we really don't have any hope left in this country, other than states like ours who are being proactive and constantly trying to come up with better laws to protect all of our New York populations, but also people who are trying to come across state lines from their anti-abortion, anti-birth control, even anti-basic emergency medical care states that are actually outlawing unbelievable numbers of procedures. So we have to be there for everybody, because they are getting more and more restrictive and punitive, and they are defining things as now abortion trafficking. If a grandmother gives her granddaughter money to take a bus across state lines, and criminalizing abortion providers, helpers, and patients. The federal government, anti-abortion states, and advocacy groups are taking legal and regulatory action, passing laws to eliminate access to medication abortions, abortion pills by mail, and trans health care. That same federal government who claimed, no, we're not going to get involved, these are states' rights, has also stripped vital federal Medicaid funding from Planned Parenthood health centers. And in fact, New York State's Planned Parenthood centers are in so much fiscal crisis that I'm just going to take a second to urge the governor to follow through on commitments to help keep them alive. Because in many parts of New York State, if we lose those centers, we have no care for our own people. So there's just no time to delay. We have to get bolder, more innovative, and we have no choice, frankly. As I said, anti-abortion states are bringing criminal and civil lawsuits against abortion providers practicing right here in New York and other states, and patients are now being targeted as well. Ultimately, the goal is to realize a national abortion ban and to restrict access to birth control and trans health care. Who imagined we'd be outlawing contraception, like in any storyline? We are here today to call on Governor Hochul to sign a legislative package of 5 bills sponsored by BPCLC caucus members that are critical to fighting the increasing federal and state attacks on reproductive rights and access to reproductive and sexual health. And with that, I'm going to pass it over to Assembly Member Jessica Gonzalez Rojas and Senator Kristen Gonzalez to speak about the bill they led the charge on, about the Department of Health Education and Outreach Program on Reproductive Health Services Bill. The bill number is A2581B and S3285B. And so I'm delighted that those two colleagues can be with us now to go over their bill. Good morning, ladies.
Good morning.
Jessica, why don't you go ahead?
Sure. Thank you. So good morning, everyone. I'm really glad to be here with such amazing fighters and advocates for reproductive justice, not just in the legislature, but from around the state as advocates and health providers that are critical. Senator Krueger said it all. We are in a dystopian moment, literally. One of the very first things Trump did when he assumed office was to delete the webpage reproductiverights.gov. That was a key resource for the Biden era policies that protect abortion and other reproductive health care services. And what we're seeing with this administration is that they are dead set on eroding our rights, and they're spreading lies, hate, division, and misinformation about reproductive health services. So we always say in New York, we will always be a safe haven for abortion care and for reproductive health services. So this bill that I sponsor with Senator Gonzalez, I always show Gonzalez y Gonzalez, a good team here. We are working to make sure that in New York State, we are codifying the current outreach and education program that's related to reproductive health care in New York. We want to make sure we're increasing public awareness by the State Department of Health and ensure that we're continuing to update and maintain that information on affordable and accessible resources of reproductive health services and education based on science, on best practice, and what's medically accurate. So this is really about ensuring that the tools and resources for all New Yorkers are available in their communities, that they're accessible, and the bill also requires the information to be translated in the top 6 languages that are spoken across the state. So I think, with the attempts at continually eroding our rights, and of course, the overturning of Roe v. Wade by our Supreme Court, it is more critical than ever that we pass this bill. Well, we passed the bill, but that we get the governor to sign the bill to ensure that we're codifying, no matter who's in office, no matter who's our future governor, that this is codified into state statute to ensure that everyone has access to the reproductive health care information and services that they need. So I'll turn it over to Senator Gonzalez to share a little bit more about the bill. And again, we really urge the governor, who's been such an advocate at the front lines and a champion on reproductive justice, to sign the bill as well as the other bills in the suite of packages. Thank you all.
Right. Thank you so much, Assembly Member. First, I just want to start by thanking Senator Krueger and Assemblymember Reyes for convening this incredible panel of, I want to say, fearless women legislators plus Senator Hoylman Siegel. So thank you for joining. But it is truly so incredible to see everyone convene today. As you heard, I'm very proud to be the Senate sponsor of the piece of legislation that Assemblymember Gonzalez Rojas just went through. But I wanted to add an additional note. One of the first things I did when I joined the legislature was pass in our first executive budget, or my first executive budget, a bill to protect our personal health data from police departments that were looking to track folks coming from other states to New York to seek their right to an abortion. And it's important to note that our state government has done a lot in the past to protect that right and to codify certain programs to allow all of us to access reproductive health care. So when we look at this package, not only is codifying programs like the Department of Health's outreach program on important things like STI testing, abortion care, and others just a common sense measure, but it really is a continuation of the work that we've been doing. And I see this package of bills as not only being urgent, but clearly something we should be prioritizing given the federal government, but also because this governor has shown that she's willing to pass this legislation through previous budgets or through previous sessions. So, certainly we're in October now, and we'll need everyone on this call to continue pushing for these bills. There are a lot of competing priorities, but really, again, it could not be more urgent for us to take a stand as the New York State Legislature to continue the work we've already done and to show the governor that she's been willing to support us in the past, and now is the time to continue supporting us through the future as things are getting harder and harder. So I certainly am proud to carry this bill, but I also want to call out the other bills in the package. I know there's S929, which is also protecting health data. As the chair of Internet and Technology, that could not be more important, and so I really want to see that one pass. And I also want to shout out S3486, which ensures patients know what is available at their local hospitals. Recently, we actually had some hospital closures in our district. So for the hospitals that are community hospitals, it could not be more important for our constituents to know what they're able to access, especially as their healthcare has been threatened across the state. So I just want to congratulate my colleagues on these incredible bills. I want to urge the governor to sign all of them, ours included, and I look forward to working with everyone here and our constituents to continue providing care in New York and making sure we're a leader when it comes to protecting our reproductive health care. Thank you.
Thank you, Assemblymember Gonzalez Rojas and Senator Gonzalez, the Gonzalez and Gonzalez team, for all your work on this piece of legislation. I think it's very important that we say that in New York, we lead with science and facts, and our package of bills is based on real data and real science that protects all the reproductive rights and choices of New Yorkers across the board. I want to now bring up and talk about the next bill in this suite of bills that we are advocating for the governor to sign. Senator Liz Krueger and Assemblymember Linda Rosenthal have both sponsored and passed through the Assembly and the Senate the New York Health Information Privacy Act. That is Senate Bill number S929. I'm sorry, Assembly Bill number 929 and Senate Bill number 2141. And I will bring them both up now to talk about their bill.
Well, thank you very much. So I have to agree with all my colleagues. We have a package that individually and combined add a whole new layer of protection for people who live in New York State or people who come to New York State for healthcare and reproductive healthcare services. And there's something that a lot of people don't know. They think their healthcare is private information, and that there's this federal bill called HIPAA that protects that information from being given away or sold or made available to others. And the truth is that's not true. If you're in a hospital setting, HIPAA applies. If you're getting your healthcare services or drugs through anywhere else, there is no HIPAA protection. And what we've been seeing is private companies selling that information, using it for their own marketing of other products. So people don't understand how much of their private personal health information is actually available to endless numbers of companies and others who want to then buy that data from companies. So I'm going to pass it over to my colleague in a minute, but I'll just use as an example. When I was debating this bill on the floor of the Senate, I was pointing out, yes, all you people who don't like my bills because I'm pro-choice think I'm talking about abortion. Well, I'm talking about abortion services, but I'm also talking about the right to get birth control and not have that information sold, or information about tracking my menstrual cycle and not having that information sold. And you men out there who sometimes watch TV at night and see that you can buy all kinds of products for sexual dysfunction that you might want to use for yourself. Well, guess what? When you buy those pills through your online companies that are selling all of this now, they can then sell you other information about sexual dysfunction that shows up on your family emails. They can have companies contact you because they have bought or sold this information. And I have to say, with all due respect to men who are on our side of this, some of the men got really upset to learn that their information about having sexual dysfunction problems would suddenly be sellable by every company in America to somebody else. And I think I even got a couple of votes from anti-choice legislators over that. So Linda's going to go into more detail. When we started working on this bill together, we didn't even know how far Donald Trump was going to go in trying to inappropriately let everyone in the world use this information. So take it away, Linda.
Thank you, and thank you to the BPPLC for bringing us together. I'm Linda Rosenthal. I represent the Upper West Side, parts of Hell's Kitchen in Manhattan, and the sponsor was Senator Krueger of the New York Health Information Privacy Act. So message to Donald Trump, if you're going to do anything in New York, you're going to have to come through all of us, and we represent multitudes. So the BPCLC's call to action could not be more urgent. When the Supreme Court overturned Roe v. Wade in 2022, it did more than just dismantle a half-century of precedent. It weaponized our own data against us and ushered in a new era where people live in fear of being punished for obtaining healthcare services simply because some may have personal objections to it. For example, right now, in our very own backyard, law enforcement in an anti-abortion state could identify and prosecute a woman who traveled to New York for an abortion by creating a digital profile to track her. All they would need to do is cross-reference HHS medical records, IRS payment data, location data gathered by data brokers to find out where and when she received healthcare, an abortion perhaps, leaving millions in danger just for the simple act of seeking essential care legally. The Trump administration's assault on New Yorkers' privacy doesn't end there. In July, HHS Secretary RFK Jr. announced his goal of having every American wear a wearable health tracking device within 4 years. Data from these devices include heart rate, sleep patterns, precise locations, and are not protected by HIPAA. They create a dangerous and trackable digital trail, consolidating information that could be used to monitor those who speak out against their regime or deport anyone the administration deems a threat, but also go after them because they're seeking basic health care. New York is a safe haven. It has been. It will continue to be when all these are signed into law. And people should feel secure coming here. But right now, there are gaping holes in our security. And so Governor Hochul, who's demonstrated throughout her career her dedication to protecting reproductive health care rights, she needs to sign these to protect the health and safety of all New Yorkers and all who come and visit our state, who use apps, who go online to order products, who want to feel that they are protected. So the Assembly and the Senate passed this bill in January on the 52nd anniversary of the Roe v. Wade decision. Nearly 10 months later, we are still waiting. We need to implement the protections that New Yorkers so desperately need right now. And so join with my colleagues. All of these bills need to be signed to maintain New York's status as a safe haven for those who need essential health care, including reproductive health care. Thank you.
Thank you, Assemblymember Rosenthal. Next up is Senator Michelle Hinchey to speak about her bill, the New York Hospital Transparency Act, which is Senate 3486, Assembly 3862. And welcome back, Michelle.
Thank you, Senator Krueger, and thank you first and foremost to all of my colleagues for your incredible leadership in this space, and to everyone tuning in to cover this incredibly important topic. My colleagues have said the landscape of what we're facing right now very well. You know, we're seeing an attack not just on reproductive health care, but on healthcare at large. And it's incumbent upon all of us, especially in places like New York, to make sure that people not only have access to the care that they need, but they know where they can get that care. And while we're seeing a lot of hospitals and other places lose care, we have to make sure that our residents and our constituents know what's available to them. And the administration has put a lot of pressure on our hospital systems to not provide the kinds of care that they deem unworthy. That's care like reproductive care, abortion care, and also transgender and gender affirming care. And we have to make sure that that's available to everyone who needs it and who seeks it. And so what our bill would do is it would require hospitals to be transparent about the kinds of care that they choose to not provide based on policy. It would require the Department of Health to have a list of that care. And so that it would empower the legislature and the rest of us to understand where there are healthcare deserts so that we can invest to make sure people have access to the kinds of healthcare that they need. What we're seeing right now as well is that, especially as it pertains to reproductive care, people select a doctor and a hospital thinking that they'll have access to something like miscarriage management, God forbid if they need it. And what's happening is when a hospital chooses to not provide certain types of reproductive care or reproductive care broadly, a patient may not even know that that choice has been made. And so when they go into the hospital needing something, they may not actually be able to get what they are looking for. That's a travesty. It pertains, as Senator Krueger was mentioning too, on both sides of the coin. It includes things like vasectomy care, right? If you want to go into your doctor and say, we want to have safe sex and we don't want to have any more kids because either financially we can't have it or we've, filled our family, you should know what kinds of care your hospital, your local hospital is providing and how far you may have to travel to get that care. In communities like mine, as I represent a good portion of the Hudson Valley and the Catskills, we have entire counties that don't have a hospital system in them. We have entire counties that are losing or being threatened to lose their birthing units. We have entire counties that are losing care right now. And so it's really important that we provide transparency to our constituents and figure out where these healthcare deserts are so that we can invest and make sure access is available and accessible for all of our constituents and New Yorkers across the board. This bill has passed both houses of the legislature twice. And I will say we were very close. I believe that we were close to getting a signature last year, but the governor, through negotiations, had mentioned that there was a fiscal and that it would require about 600 hospitals to provide this information. That just is not true. There's only about 200 hospitals in New York State, and so the number is a lot lower. And we worked really hard to get this bill in the budget this year, and we were unsuccessful. We cannot wait any longer for this information. We have to start to get this transparency so that we can invest and make sure everyone has access to the reproductive care and health care that they need, including in rural areas. And so I implore the governor to come back to the table with us to negotiate this bill and to get it signed. 2 times is the charm, and this package would go a really long way with this bill included to make sure that all of our constituents have the care that we all believe and know that they deserve. Thank you.
Thank you, Senator Hinchey. And thank you for conveying that sense of urgency. I think last year's conversations should be very different than the conversations we're having this year in terms of getting bills signed and over the finish line. I would like to now bring up Senator Brad Hoylman-Siegel to talk about strengthening legal protections for reproductive and gender-affirming healthcare, bill number S4914B and Assembly Bill number 5480C.
Thank you, Assembly Member and Senator, for convening us, and all of my colleagues, all of my strong female colleagues, glad to represent here. As we know, every day the Trump administration and hostile states escalate the threats against providers of abortion and gender-affirming care and the patients who depend on that care. And these threats are not hypothetical. Just a couple of examples. Over the summer, the Department of Justice issued subpoenas demanding confidential patient information from more than 20 doctors and hospitals providing gender-related treatments to minors across the country. The FTC even convened a full-day forum scrutinizing this care, naming specific clinics as potential targets for federal investigation and legal action. And at the state level, a Louisiana court indicted a New York abortion provider. Let me say that again. A Louisiana court indicted a New York abortion provider, and that is the specter that we're confronting today. And Texas is pursuing legislation specifically intended to allow private citizens to sue New York care providers who manufacture, distribute, or ship abortion-inducing drugs. And providers across our state are sounding the alarm that the legal process is being weaponized to criminalize abortion and gender-affirming care that's legal, evidence-based, life-saving, and protected by our state constitution. In 2022 and 2023, New York took action to protect access to abortion and gender-affirming care by passing SHIELD laws. These are legal protections for New York abortion and gender-affirming care providers, those they care for, and those who make access to care possible. These laws have already been used to protect a New York abortion provider from being arrested, extradited, and fined by 2 anti-abortion states. And while these laws were important to protect access to care, additional legislation is needed to strengthen them in response to new and emerging threats. That's why I'm proud to sponsor with Assemblymember Harry Epstein the SHIELD Law 2.0, as was said, S 4914, B, and A 5480C, to ensure New York remains a safe haven. The bill protects information about sensitive health care being held by private institutions like hospitals, clinics, and nonprofits. The bill would protect that information by expanding protections that currently apply to information held by government actors to these private actors, and also create a process that out-of-state government actors must follow when requesting information from private entities in New York. Together, these changes will ensure hostile actors can't exploit loopholes that may allow for enforcement of out-of-state subpoenas. Secondly, the bill ensures all professionals involved in the provisions of care, from advanced practice clinicians to therapists, are explicitly shielded and included in New York's legal protections. And third, the bill ensures that New York courts apply New York's SHIELD law protections by requiring that they apply in any case regarding reproductive or gender-affirming care that is heard in the state. This legislation is urgent. The war on abortion care, the war on gender-affirming care is real. It's happening across the country. The governor needs to sign our bill without any further delay. Thank you to all of my colleagues.
Thank you very much, Senator Hoylman Siegel. So our last bill that we're talking about is the insurance coverage for pharmacist provided birth control services, S6441A and A6917A. It's the lead sponsors are Senator Skoufis and Assemblymember McDonald. Unfortunately, neither of them are here to attend today, but they've asked me to read a brief statement about their bill. The right to make one's own decisions about abortion and contraception are fundamental, central to health and economic well-being. As American women watch their rights being ripped away in states across the country, there's no better time to shore up protections for reproductive rights here in New York. This package of legislation in total is nothing short of imperative. We're proud to see the bill, which would require state-regulated private insurance carriers to reimburse pharmacists for contraceptive care, included in this package. New York is experiencing a significant shortage of OB-GYNs, particularly in rural areas, so pharmacists are often the most accessible healthcare providers in these contraception deserts. We stand with our colleagues in urging the executive protect the rights of New Yorkers and sign this legislation and the entire package of bills into law. Thank you.
Thank you, Senator Krueger. Those are our 5 bills. That is our package, and we are urging the governor to take action on them swiftly. I think all of our colleagues have expressed the sense of urgency and the real threats that our communities are facing in terms of access to healthcare, and all of these bills will be protecting New Yorkers. And now we're going to open it up to questions if there are any from the press, but otherwise, I believe that is it.
Thank you, Assembly Member. If you're a reporter with a question, please use the raise hand function, and I will allow you to unmute. Dan Clark, I see you. I'm going to allow you to talk now. You should be able to unmute.
Hey, everyone. Great to see you. So on this package of bills, I'm curious, have you had any communication with the governor's office about it? And particularly, I'm sorry, I got here a little late, so I'm hoping this bill is in the package, but the New York Health Information Privacy Act has been passed since January. And I'm curious if you've had any communications with the governor's office about that bill in particular, and whether maybe a chapter amendment is going to happen.
I think Senator Krueger can take that.
Or
Assemblymember Rosenthal.
You're muted.
You're
Senator.
muted, Liz. You're muted.
I mean, over the months, we've both had conversations. I know a lot of the advocates, Allie from Allie Bohm from NYCLU and others have had discussions. There's a lot of discussion going on, but you know, the time to sign it is now. Liz?
yes, we both signed a letter to the governor quite a while ago now urging her to move this bill as quickly as possible, because these aren't hypotheticals. These are actually happening to real people and real medical providers here in New York, or people coming to New York. So we are hoping that this whole package of bills can be moved quickly by the governor, because they're all important. And we understand the pressure on the governor, excuse me, to respond to so many bills the legislature has passed. But we want to emphasize these are, in our opinion, easy wins in New York, because we do have a strong caucus of pro-choice legislators in both houses. We've passed important legislation, and Kathy Hochul, our governor, has a strong and proud record of supporting reproductive health and sexual health. So we're hoping that we're sort of kickstarting some attention to Linda and my bill and the other 4 bills. And that's why we're having this press conference today.
Thank you.
And since the assembly member cold called me, Allie Bohm, she, her pronouns, I'm a senior policy counsel at the NYCLU. I just wanted to add that the New York Health Information Privacy Act is very, very similar to the Children's Online Privacy Bill that the governor signed with great fanfare and really championed last session. I think we are hopeful that she will recognize that the same protections that should apply to young people's data should apply to health data, given the incredibly high stakes in this moment in time that I think the senators and assembly members here really captured very well in their remarks.
Thank you.
Any additional questions? And I'm not seeing any. That we will be sending out a release with a recording of the event for anybody who missed any part of the presser as soon as we can afterwards. And I'll pass it back to you, Senator.
Well, I just want to thank everyone for their participation, and also highlight that the materials we send out will list the organizations who are here as our advocates and our backup. So reporters are also certainly welcome to reach out to any of them with more detailed questions about the importance of these bills. Assemblymember Reyes.
Thank you, Senator Krueger, and thank you to all our colleagues for all their work. And of course, our partners in the advocacy space for always being supportive and vocal around the issue of reproductive rights. And I am just happy to co-chair with you, Senator Krueger, on and lead on this issue in New York. I think it is critical for us to continue to speak truth, to be led by science and by facts, and not to fear some of the chaos that's coming towards us. And I think history will be on our side when we look back at this moment.
Thank you, everybody, for attending.